Welcome back to Midday Kentucky, everyone. Well, Georgetown Bariatrics and Advanced Surgical Services is on the forefront of providing metabolic surgery for the fighting of diseases and type 2 diabetes and obesity. Dr. Eric Smith has performed well over 1,000 of these procedures and has impressive outcome stats. We have Dr. Eric Smith here with two of his amazing patients with their success stories, Christina and Nikki. How are we both?
Great.
Okay, I love when we do these type of shows where we get to see the before and afters and have that conversation of the journey.
Absolutely.
Okay, and people at home love to see those results. How are you, my friend?
Doing good.
Let's talk a little bit about both of these ladies and what procedures you decided to do on them.
So both of these ladies had surgery within about, I think, a week or a week and a half of each other. They can tell you more about that. And they both had a robotic sleeve gastrectomy, which is the most common surgery that we do at our practice, as well as the most common surgery done in the United States for weight loss surgery.
Yes. So gastric sleeve for both?
Yes.
Why did we choose both the same? Because you offer many different procedures.
Well, ultimately, it's up to the patient. We try to educate them the best that we can what the options are.
Yep.
But they pretty much chose that procedure on their own.
Okay. Now, before, I don't want to show any before pictures, anyone, not just yet. Okay, we'll get to that in our next segment. I want to find out at what point were you looking in the mirror, or you both being best girlfriends, out for lunch or dinner, did you go, enough? Where were you? At what point?
For me, it was kind of a light bulb moment when I was out of town, and we had discussed it prior, but I was always the one that was like, okay, let's try diet and exercise. Let's try something, you know, I was always the voice of reason. So the light bulb moment for me was when I was out of town and I was with my mother, and we had all of my children with me, and my mother was just running around with my kids, and I didn't have any energy whatsoever, and I thought, okay, this is it, something's got to change. So that's where it began for me.
Okay. What about you, my darling?
I had a lot of health issues that went along with my weight, and my dad actually had a massive heart attack when he was 34.
34.
And 34 was the exact age that I had this surgery, and I decided that I was gonna get a hold of all my ailments, you know, while I could, and it has.
Wow.
I'm no longer on any medications whatsoever. It's taking care of all of everything.
Before, as I said, I'm going to show the pictures in our next segment, but what weight were you when you first went in for your first consultation?
255.
255.
Was my highest, yeah.
I was 225.
Okay. How has your life changed? Forget the medication part. Let's talk about lifestyle, because that's what people want to hear.
Oh,
Are you
absolutely.
out running around and
Yeah.
buying clothes?
Oh,
and
yes.
Wearing the heels?
Yeah, most definitely. And I have an 11-year-old little boy, and you know, I couldn't get out and do all the things I wanted to with him before.
Yeah.
And now we're out, you know, running around, and I'm outside playing sports with him, and you know, we're doing a lot of things that we didn't have the
Energy.
for.
Yeah.
Yes.
A lot more energy now?
Oh, yes.
Much.
Okay.
Yeah,
Yes.
much more energy.
All right, we're going to get back into it. We want to ask you lots of questions when we're back after the break.